Hi, I'm Dr. Jason Ryan, and welcome to Heart Talk, Nursing Assistant Module 2, How Heart Failure Patients Stay Healthy. Heart failure is a lifelong disease, and patients that have this disease are going to be dealing with it for the rest of their lives in one manner or another. These patients have hearts that don't work the way they should, and this leads to the body holding on to water, which leads to the symptoms of heart failure. However, by making good lifestyle choices, these patients can live well and enjoy a long, active life. There are 6 key recommendations that heart failure patients should follow in order to feel well and stay out of the hospital, and we'll go through each of these in this video series. The first recommendation is to take medications as ordered. The second is to go to their doctor appointments. The third is to monitor symptoms and weight daily. These patients need to monitor eating and drinking. They need to exercise and stay active according to their doctor, and they need to limit alcohol, caffeine, and tobacco use. So let's go through each of these one at a time and talk about why they're so important. The first recommendation is to take medications as ordered. Heart failure patients should know that if they take their medicines, they will live longer, feel better, and spend less time in the hospital. And heart failure patients need to take their medicines whether they are feeling well or feeling sick, because the medicines benefit their heart all the time, and they're going to be on most of their medications for the rest of their lives. You can help your patients take medications as a nursing assistant by notifying your nurse if your patient has any trouble taking their pills as ordered. These could include things like patients who can't afford their medicines, patients who can't get to the drugstore to pick them up, or patients who are having trouble reading labels. Any of these difficulties should prompt you to notify your nurse so that they can work with the patient to make sure they can take their medicines as ordered. The second recommendation is to go to doctor's appointments. Patients who go to their doctor's appointments feel better, live longer, and stay out of the hospital. And one of the things I hate to see as a practicing physician is one of my patients miss an appointment and then call me several days later saying they're not feeling well, or maybe they ended up in the hospital because they're very sick. I can avoid a lot of this downturn in how patients are doing. I can keep them from getting sick if they come to see me, and I can examine them and check their vital signs and adjust their medications. But it's extremely important that they come to all their scheduled appointments. The third recommendation is to monitor symptoms and weight daily. Remember that the common heart failure symptoms are difficulty breathing, swollen ankles, legs, or abdomen, which is what we call edema, and feeling very weak or tired. If heart failure patients experience any of these symptoms, they should notify their nurse or doctor. Weight is also extremely important for heart failure patients. When they begin to retain extra fluid, the weight gain is noticeable up to 2 weeks before they feel symptoms. So by weighing themselves every day, these patients can monitor their status. In effect, the scale's like an early warning system. It'll start to show an increase in weight well before the symptoms come on. And by obtaining a daily weight, heart failure patients can stay well, and they can get in contact with their nurse or doctor to intervene before they get very sick. Patients need to weigh themselves every morning at about the same time, and I tell my patients to weigh themselves after urinating, before they have anything to drink, in the same amount of clothing, and in the same scale. They should notify the nurse or doctor when they have a 3-pound weight gain in one day or a 5-pound weight gain in 1 week. These weight gains are too large to be explained by the regular fluctuations in weight that all of us have, and they almost certainly represent extra fluid being retained, and this means the patient may be starting to get sick, and this is when the doctor or nurse can intervene to help them stay well. We teach our heart failure patients at the University of Connecticut to self-manage by following the heart failure zones, and this is a simple way for them to pull together all the symptoms and the weight to determine how they're doing overall. We tell patients they're in the green zone if they have no shortness of breath, no weight gain of more than 3 pounds in a day, no swelling of their feet, ankles, legs, or stomach, and no chest pain. For these patients, we tell them to keep up the good work, keep taking their medicines, keep eating a low-salt diet, and keep weighing themselves every day. The green zone is where we want our patients to be as much as possible. Patients are in the yellow zone when they have a weight gain of 3 pounds in a day or 5 pounds in a week. They have more shortness of breath, more swelling in their feet, ankles, legs, or stomach. They may feel tired. They may have new or unusual coughing. They may have dizziness. And it may be hard to breathe lying down to the point that they're sleeping sitting up in a chair. And these patients should notify their doctor or nurse because they may be starting to get sick, and this is the point at which an early intervention like a change in medicines can help them stay well and keep them from getting sicker. Patients are in the red zone if they're having a hard time breathing even at rest, if they have chest pain or discomfort, or if they feel faint. And these patients may be having a medical emergency, so they should call 911 or get help urgently. The fourth recommendation is to monitor eating and drinking. Salt is the same thing as sodium, and in the medical field we use the word sodium a lot, and many people know what it means, but this is not always true for heart failure patients. And if they're going to read labels to determine how much salt they're eating, they need to understand that sodium and salt are the same thing. Too much salt makes the body hold on to water, and this leads to the swelling and the symptoms of heart failure, where it leads to patients essentially getting sick. So by sticking to a low salt diet, patients can stay well and stay out of the hospital. Common dietary sources of salt include soups, particularly canned soups. Those are loaded with salt. Frozen TV dinners, hot dogs, and deli meat. These all have lots of salt. And when heart failure patients eat these foods, they tend to swell up and they tend to get the symptoms of heart failure. Some other dietary sources include sea salt. Some patients think because it's from the sea it must be okay, but it's not. It's the same as any other salt. Adobo seasoning, which is used in a lot of dishes, but particularly those of Spanish or Caribbean origin. Salad dressings, cheeses, and soy sauce all have lots of salt. Jarred tomato and pasta sauce have lots of salt, and so do pickles, sausages and kielbasa, ham and bacon, and French fries. All these foods are loaded with salt, and if heart failure patients eat them too often, they will retain fluid and get sick. Patients with heart failure need to know how to read a label on food. We tell them to set a goal of eating less than 2,000 milligrams of sodium per day. If you look at the label on the screen right now, you'll see that it says there's 190 milligrams per serving. This might lead a heart failure patient to think they could eat the entire package of food and only eat 190 milligrams of sodium. However, if you look at the top of the label, you'll see that there are 12 servings per container. This means that if you eat the whole package, you would get 12 times 190 milligrams of sodium. This would be way too much, and it could lead to a heart failure patient getting sick. So heart failure patients need to know how to read labels so they can control how much salt they eat. Sometimes doctors have to limit the amount of liquids a patient can have every day with heart failure. Luckily, this isn't required very commonly, but we do have to do this once in a while. So for these patients, they need to watch how much they drink, and they also need to be aware of some foods that count as liquids. These include yogurt, pudding, ice cream, jello, and fruits like orange or grapefruit. For example, one orange or half a grapefruit has 4 ounces of fluid in it. These patients should space out their liquids over the day and save liquids for when they have to take their medicines, although there are some patients who can take their medicines with applesauce instead of a drink. And there are some tips they can follow to battle thirst. They can use ice chips or rinse their mouths out. They can freeze juice in an ice cube tray and suck on the cubes. They also can use lemon wedges, gum, frozen grapes, strawberries, or hard candy instead of drinking. As I said, luckily, fluid restriction is not something we commonly have to do. The fifth recommendation is to exercise and stay active. So it's important to know that specific activity levels have to be determined by the patient's doctor. There are some patients for whom it's not safe for them to exercise, so they have to check with their doctor to make sure it's okay. However, for the vast majority of heart failure patients, exercise is completely safe, and in fact it's beneficial for the heart. So most of my heart failure patients, I give them a green light to exercise whenever they like. And for some of them who aren't used to exercising, I recommend they go to cardiac rehabilitation. This is an exercise program where they work with an exercise specialist to help them get used to what kind of exercises are safe and get used to walking on treadmills and riding stationary bikes and things like this. A lot of my patients ask me if it's safe for them to have sex or drive. Again, these decisions have to be individualized. Each patient has to check with their doctor to make sure it's okay. However, for the vast majority of patients, both of these activities are safe, even if they have heart failure. The sixth recommendation is to limit alcohol, caffeine, and tobacco use. Patients need to check with their doctor about alcohol, caffeine, because there are certain situations where it's not safe for them to consume either of these. However, for most heart failure patients, these things are okay in moderation. Alcohol should usually be consumed less than 2 drinks a day for men and less than 1 drink a day for women. And caffeine should always be consumed usually less than 1 or 2 cups per day. And for patients who have heart failure and smoke, they need to stop. This is bad for anyone, but smoking is especially bad for people with heart failure. It makes the heart work harder, and it can lead to heart attacks. And if patients are having trouble quitting, they should ask their doctor or nurse about help. So to review the 6 recommendations for heart failure patients, they should take medications as ordered, go to their doctor appointments, monitor symptoms and weight daily, monitor eating and drinking, exercise and stay active according to their doctor, and limit alcohol, caffeine, and tobacco use. Heart failure patients who follow these recommendations will feel well and will stay out of the hospital. Thank you very much.